But we had a chance, the Public Health Department had a chance to apply for some federal funds from the Centers for Disease Control to put together a more formal AIDS program. And by then, we had the word HIV because the antibody, the virus had been co-discovered and an antibody test had been discovered. And Public Health Department wanted somehow to build a larger clinic entity, larger and more specific than the nurse practitioner run AIDS assessment clinic could provide. So the Centers for Disease Control had some first-time grant monies available to set up what they call demonstration projects to see what kind of facility in a public health department would work for responding to the AIDS epidemic in various cities, depending upon what was happening in various cities. So my former bosses at the Public Health Department asked if I would come back and help them write that grant proposal, and Bob Wood was asked to come and help with that too, and we were one of the 5 cities in the United States to get Centers for Disease Control funding to start an AIDS program. And so I came back and worked as a temp for a couple years, helping to start that program, helping to get a facility we were on First Hill when we started out, and to figure out the logistics of how to do HIV antibody testing, how to set up confidential testing sites, how to set up sites that would allow anonymous testing where people wouldn't have to use any kind of a real name. Because part of the idea of a demonstration project was to try out different ideas and see what worked and what didn't work in different settings. So one of our goals in setting up this clinic was to see, one, if we could gain the trust of the community to come in, because there was a lot of fear about this antibody test. There was very little in terms of treatment that could be offered to people if they tested positive. But then they would know for sure that they had this virus. And they didn't know what the outcome was going to be, how long they might live, how long before they might get sick. So there was a good deal of controversy about whether this test was a good thing or not, whether it put people at risk for discrimination, whether it was going to make people just more worried because they got a positive test but they maybe couldn't do anything about it. So part of our work was to figure out ways, and try out by trial and error, ways to help gain confidence, especially of gay male community members, and enough confidence in the Public Health Department that we could keep their information confidential, that we would be sensitive to them, that it would be a safe environment, and to measure what worked and didn't. That was our charge from the CDC. Figure out what works, figure out what doesn't work.